Right. Okay. Good afternoon, everybody. Welcome to this public update meeting. Joining us today, we have Deputy Chief Fire Officer Jonathan Foster, who's going to go first. We've got Chief Constable Lisa Winwood and Assistant Chief Constable Mike Walker, who will talk us through some of the criminal justice implications, but will also give us an update on the wider response to COVID-19 as he chairs one of the local resilience forums groups organising our response to this. So we've also got a number of questions from the public. What we will do is go through the updates first, and then any questions that are not answered through those updates, we will deal with directly. John, if I could go to you in the first instance, is that okay?
Yeah, that's great. Thank you very much. And hello, everybody. So we spoke 2 weeks ago, and so this is really an update of where we are within North Yorkshire Fire and Rescue Service with our planning arrangements for COVID. And then I'll also touch on the arrangements we've now got in place for the Nightingale Hospital at Harrogate. So our priority remains that we maintain our full ability to respond to emergency incidents, and we've adapted our working practices to safeguard the public and our crews from the risk of any unnecessary exposure from COVID. Our appliance availability levels are running high, approximately 95% availability, and that's without the use of what we call the operational staffing reserve. So that's very good. So I'd like to reassure the public that we are very much able to respond to incidents as normal. We have had some incidents of sickness. 2 weeks ago, we reported that our self-isolation was around 5%. I'm pleased to say that that's now dropped to about 3% of our workforce. So that's a positive. Working from home is enabled for those that can do so, and this is proving very effective in supporting our frontline crews and obviously the support for the public. Day-to-day business has been disrupted, but we've adapted our ways in which we can work, and that continues for both response, prevention and protection activities. We heavily involved still with the Local Resilience Forum and regional and national plannings with the National Fire Chief Council. So we've installed some video conferencing facilities on over 50% of our fire stations now. This is something we've brought forward, and we aim to complete that programme within the next 2 weeks. What that actually means is that now we can deliver some training to our operational crews remotely, but also we're exploring opportunities now for wider use of the technology to deliver prevention and protection messages out to the public. And a good example of this is that we've recently introduced classes again for the fire cadet schemes. So we're now able to deliver fire cadet scheme classes using technology, and of course we will start and broaden that out to the wider public in other prevention messages. Our prevention teams have been working very closely but remotely. So community safety officers and operational crews over the past month have made telephone contact with over 850 of our most vulnerable people within the community, and that's to provide additional home fire safe advice and guidance. Now, these phone calls have extended from the core business also into providing a friendly chat for some of these residents, and many of them are feeling lonely and isolated, and so operational crews are now involved in being that friendly person on the end of the phone and helping out with some of these fears that people may have. This itself has drawn into an area that some residents are concerned about scammers, and indeed have been unsure whether our staff have been legitimate or not. And my advice for people like that is, if you're unsure, hang up. But by all means, that call us back on 01609 780 150, and then we can prove that we're being genuine. Also, there's more details on our website for that. We are still waiting for some national vulnerability data coming through. There's a data sharing agreement that's been in progress but we're still waiting for that. And once we've got that information, then we'll be able to broaden out our prevention activities to some more of the vulnerable people out there. Where necessary, I'd just like to assure the public that we will make home visits should we need to do so. So if people have got smoke alarms that are faulty, batteries running down and causing a nuisance in that respect, we still can come along and replace these smoke alarms. Where possible, we are leaving smoke alarms for self-installation, but for the most vulnerable, using PPE and risk assessment, we can come in and change these up. I just want to give that assurance to the public that we can still do this. There is a tri-party agreement. We discussed this a fortnight ago, and this is where the Fire Brigades Union, the National Fire Chiefs Council, and the national employers have all agreed some adjustments to the normal working practices. Now, I'll just run through these now. There's been a few additions over the next couple of weeks. So ambulance service assistance and ambulance driving is something that we are involved with. We've got 12 drivers now trained to drive ambulances. 6 of them are actively engaged and 6 of them are on recall arrangements should the situation escalate. We've been the part of the agreement is for delivery of essential items to the vulnerable people. And we've been involved in this in many respects. In first of all, delivery of food items, and we've delivered over 50 items of food out to the members of the public, and also over 20 prescriptions have been made out to the public. We are developing this work, and we're working locally with the volunteer networks. Much of this work is being undertaken by volunteers, but our offer of support is there for them, and now and again we are called in where their resilience hasn't proved effectively enough. So that work will continue. Hopefully it will develop, but we remain committed to being able to help out where possible and where the need is. Another area of the tri-party agreement is the mass casualty movement. Fortunately, so far, that's not been a demand in North Yorkshire, and therefore we've not been asked to get involved with that, but we are able to do so should we need to. Let's hope we don't need to. Face mask fitting for frontline NHS staff is something that is now part of the agreement. We have been involved in an initial scoping exercise, but again, no formal request has come through to actually deliver on that yet. Delivery of PPE and other medical supplies to the NHS and care facilities is something that's now included. And we have got a number of requests now to help out with delivery of scrubs and visors. And we are now working through the risk assessment to get that work underway as soon as we possibly can do. That will be hopefully within the next day or two. Driving of ambulances on non-blue light situations, for example, transporting people for outpatient appointments, is another area that we can now get involved with. Again, it's a new addition, is this one, and so far we've not been asked to do so. Another one is to assist taking samples for COVID-19 testing. Again, this now falls within our ability to help out with those arrangements. Again, early days, and we've not yet been asked to do this, but it's there should we need to do that. And then finally, the ability for our fire and rescue service staff to deliver, our driver trainers, I should say, to deliver training for non-emergency service staff to drive ambulances under non-blue light conditions. Again, that's a new addition, but so far we've not been asked to undertake that. I'll just move on to our incident demand. We've run an exercise of looking at the data from the same period of time last year as this year. So we've taken from the period of lockdown, so 4 weeks, and we've seen a decrease in overall incidents of 170. We did, in the 4-week period, we've done 464 calls. Last year, same period, was 634. So a decrease of 170. Much of that's automatic fire alarms. They're down by 50 compared to last year. Vehicle-related incidents are also down in terms of road traffic collisions. We've attended 4 within this current period compared to 23 same time last year. But I would urge the public, whilst the roads may well be quiet and less traffic on there appears to be an increase in cyclists and runners and walkers taking their exercise. And so I would urge the public to really think about their behaviour on the road when they are driving, and please beware of other people on the roads nowadays, and also obviously make sure that we're not contravening speed limits, because the roads are quieter than being maybe a tendency to do that. Controlled burn is another area that we've got an increase with. So this is where people are having bonfires at home, and we're getting a lot of calls to these now. We've had over 30 in the last 4 weeks where we've been called in, and I would urge again people to be responsible if they are going to start burning rubbish at home, garden rubbish, etc. Think about the neighbours, think about where the smoke may blow. Preferably, just wait and don't do it, and wait until the proper waste collection services do come back in service at some point soon, hopefully. And finally, on the incident side of things, just a word out to the public. The fire severity index rating for both North Yorkshire Moors and North Yorkshire Dales National Park is at the very high level. And we urge people that if you are taking exercise in these areas, please be vigilant, be careful, and do not take cigarettes, lights. Don't be tempted to go and take barbecues, because that just is not what we need. We do not want more fires, and we do not want wildfires developing in such difficult times. So that's a general overview of where we are on the service as a whole at the moment. What I'd just like to give you now is an update on our arrangements which we've got in place at the Nightingale Hospital at Harrogate. Now, this becomes live today. There's an opening ceremony this afternoon. We have been asked to provide a dedicated fire engine to the Nightingale Hospital, and that's provided from Harrogate Fire Station. We've made adjustments to our predetermined attendance, which is where we mobilise a set number of appliances out to various incident types. So we've made those adjustments now. We work very closely with the NHS staff to ensure that the Nightingale Hospital has got suitable fire prevention measures and good working practices within their local procedures. We've included risk assessments for our own staff that may need to operate in the high-risk COVID environment also. We've developed operational plans, and we've included a range of different scenarios in these, and we've taken into account oxygen and other facilities which is now present on that site. And I'd like to say we've also included our regional colleagues from West Yorkshire within these plans. All the local crews from the surrounding area and Harrogate Fire Station, as well as local officers, have been visited the site, familiarised themselves with the changes within the building there, and learned and understand the revised layout and the increased and new risk that's posed within that building. And finally, we've tested our mobilising arrangements now. So we've tested these plans out, and we've made sure that our local crews are also now prepared also with all the information they need locally in terms of the plans that have been drawn up and developed. So really, we're ready now. From today, we're ready. We're prepared for any eventuality, hopefully, that may come from that new risk which we've now got in Harrogate, which is a fantastic facility. Let's hope it's not needed in the current circumstances.
Okay, that's great, John. That's fantastic, John. Thank you very much for that very thorough update. I've just got a quick question.
Yep.
Garden fires. So is this increase? We've seen. I was talking to some of my PFCC colleagues in other parts of the country. They've seen a similar increase in fires in gardens. Do you think this is indirectly related to the fact that there's no household tips open?
Yeah, it's difficult to predict really, but there's certainly an increase compared to what we've seen in past years, and certainly the garden waste has been suspended in the area that I live. It was suspended for 1 week, but the amenity centres are closed, so I would imagine it's directly related to that. I think it's also people are clearing out sheds and garages and taking advantage of doing that whilst they're on furlough and lockdown. But I would really urge people not to burn it at home. It's just not helping the situation at all.
Okay, so I think if it's possible, I think that national data would be really helpful. So I was talking to Roger Hurst in Essex, and he was talking about a similar issue. I know they are reconsidering the status of the tips at the minute and whether or not they might reopen them. I think that's something that is being considered. So that data would be really, really helpful, John, because it would feed into those discussions that are happening. I know there are some concerns around it not being essential journeys and all the rest of it. But if there are knock-on consequences that haven't necessarily been anticipated, then we need to understand the extent of those and what they are.
Yeah, by all means, I can make sure we provide that. Yeah.
Okay. Just can also, what data are you? Why are you waiting on a data sharing agreement? What's holding that up?
So you'd be aware there was the 1.5 million vulnerable identified, and there was letters went out to the residents on that. We're waiting for that data coming through so that we can analyse, and then we can work along with our partners to go and make sure that safety precautions are in place. And unfortunately, it leads back to data sharing agreements. We've got things set up now with North Yorkshire County Council to access the data, but unfortunately, because of the data sharing agreement, that we still haven't got our hands on that data, and it's really frustrating. But we need to get that speeded along. I'm assured that it's going to happen this week, but let's hope it does. But it needs to happen.
Right, that doesn't sound very satisfactory at all, and perhaps that's something that we can raise it. So it's a local issue between the county council and the fire rescue service.
It's wider than the fire and rescue service. This agreement will cover all partner agencies, so it gives all the partner agencies that need it the access to that data, and we're still waiting for that.
Is that from the county council though?
Yeah, it's an agreement which covered. Yeah, it's been developed by the county council, but it would cover all of the agencies. Yes.
Right. Okay. All right. Well, that needs picking up then, doesn't it? Because the higher risk probably is the vulnerable people as opposed to the data sharing agreement. So yeah. Okay. All right. Thank you. Has anybody else got any other questions? Got any questions for John? No. Okay.
Quick question. Just John. You covered this kind of very briefly, but I just want to get a comment from you in terms of cover in Harrogate, cover for the rest of Harrogate, the population, the rest of Harrogate. That remains as usual. Aside from the cover for the Nightingale.
Absolutely, Tom. What we've done is we've changed the. We've historically had 2 fire engines at Harrogate. That still remains the same, but we've managed to adjust the mobilising criteria, and we've boosted the staffing levels at Harrogate as well. And so we're still maintaining the fire cover across the Harrogate district, the same as we have done, but we're drawing in appliances from other areas and taking advantage actually of the good availability levels as well. So, for example, we will use Knaresborough, Summerbridge, and possibly Boroughbridge a lot more into the Harrogate area to support where necessary for those 2 and 3 pump incidents. And at the same time, we will always maintain that we've got an appliance available for the Nightingale Hospital.
Can I ask a quick question, John, which was just whether costs are increasing given our much more availability of our volunteer firefighters, and whether any deployments might then start costing more?
So costs are a concern for us within this period. We are monitoring the costs very much so all the time, and we'll continue to do so. We have had a grant from the government to help out with the COVID planning, but of course it's a fine balance, making sure that we're providing the correct PPE levels and the staffing arrangements. So at the moment, I would say that there's no real increase in the staff on the on-call side of things because our call levels are reduced and they get paid for when they turn out. But certainly the Harrogate side of things, yes, there's an increase in cost there to provide that dedicated resource. But we are monitoring and tracking the costs associated with that.
Right. Okay. Thank you. So I think that is probably it for you, John. If you want to go off and go to the Nightingale, thank you very much indeed for that update. It is much appreciated.
Thank you very much. Thanks. Bye, everyone.
Thank you. Okay, so if I could now turn to Chief Constable Lisa Winwood, if that's all right. Lisa, that would be great.
Okay, thank you, Julia. And very similar to the update from 2 weeks ago, here in North Yorkshire, from a policing perspective, we have very low abstraction rates and are still delivering a normal service out there in the community. So we're still out there. You'll still see our visible staff and officers out there delivering a policing service and tackling criminality and keeping the public safe. And we have indeed had a number of cases over the past couple of weeks where criminality has been tackled on our roads, people moving around with the intent of committing crime. So we are still out there delivering a normal policing service. We are, of course, in the middle of an unprecedented health crisis, and we continue to work closely with our partners in the local resilience forum. And Mike obviously is undertaking the role of the police within that wider partnership arrangement. And we are continuing to support the guidance issued right at the very start of this health crisis of asking people to stay at home. It's the absolutely best way to prevent the spread of the virus. And we want people to be safe and be well and to save lives. And we will continue to support that message. Thank you to the public. The vast majority of people within North Yorkshire are absolutely following that guidance. We're very grateful for the support of the public, but there are still a minority who are not following the national guidance, which is there for everybody's health and safety. So reminders, really, we continue with engaging with our members of the public in our communities, explaining to them the reasons why it's important to socially distance, to self-isolate, to stay at home so we can protect the NHS. Having explained that, we encourage people to follow that guidance, and only in exceptional circumstances where it really is a last resort, we have utilised the legislation in terms of enforcement. We've issued a number of tickets over the past weeks, but they have predominantly been in situations where people are moving around for journeys that are absolutely not essential, and people are travelling hundreds of miles either across our county or into the county to undertake activities that they could undertake much closer to home, and there really isn't a reason that is proportionate or necessary for them to make those journeys. We've also had a number of groups of people together, predominantly on the East Coast. We've had a lot of groups of people drinking, socialising with each other, and again, putting others at risk in terms of each other's safety and the spread of the virus. So just to remind people, a lot of the questions that have come into us are about what people can and can't do. So just a reminder that those reasons not to stay at home are few and far between, and they include people taking their essential exercise and therefore any essential travel to get that necessary exercise, people going out for medical appointments, medical reasons and need, people shopping for essential goods, so that they can stay healthy and well and eat and look after their families. So they're the main reasons why people should be out of their home addresses, and we will be continuing to stop and engage with the people and ask them about their journeys and assess whether those journeys are essential. You can, of course, go out to work if you cannot work at your home address. So the definition of what type of work you can go out to do is not it doesn't have to be key workers or essential work. If you cannot do your job at home, you can go out to work and travel for that reason and go to work. But of course, this is about preventing the spread of the virus. So we absolutely want people to socially distance, take those extra measures of hand washing, looking after each other, and abiding by the guidelines. After all, this is about the prevention of the spread of the virus. So there are a number of questions about what's acceptable exercise, etc. Obviously, the government have given some guidance on that in terms of walking, cycling, running, those sorts of exercises. We've had some specific questions about allotments. The Allotment Association has kindly put some guidance out, if I could direct people to that website. But of course, some people, their exercise is working on their allotment, digging, looking after vegetables, moving around. So there are obviously people who, if that is their essential journey, to take their essential exercise. But each and every case depends on those individual circumstances. And we want people predominantly to stay at home and prevent the spread of the virus unless those essential journeys are required. You'll also see that further guidance continues to be issued. Only this week we've seen some additional information provided. So this has come from our criminal justice partners. So we work closely with the Crown Prosecution Service and other criminal justice agencies in that criminal justice journey, and they have provided some additional guidance on what might be reasonable in terms of prosecution. That is not police guidance, it's guidance from a criminal justice partner that absolutely we would want to be aware of. But just to reassure the public, we continue to operate under the original guidance that was provided of what is essential in terms of exercise, medical support, supporting vulnerable people, going out for your essential shopping. But at the end of the day, the best way to prevent the spread of the virus is to stay at home and try and abide by some of that medical guidance that's been provided out there to the public. And so we are still operating in normal policing environment. We have seen a reduction in calls for service in terms of traditional crime, with people clearly being at home rather than out and about. And we are looking at health and safety of our staff. PPE is available, and also dealing with a lot more incidents over the telephone where we don't want to either put the public at risk by us attending your address and potentially spreading the virus, but also if you're poorly at home, not then coming to your home address. So we have changed some of the ways in which we are dealing with some of those calls for service to a more telephone-based system, but absolutely our officers and staff are out there continuing to deliver a policing service to tackle criminality and keep our public safe.
So that's very helpful, Lisa. So just two things, and then I will just turn to some of the specific questions, if that's all right. So the first thing is, just for complete clarification, then, there has been no relaxation of the rules. People are advised just to go out for essential exercise and not drive long distances, and to stay local. And that's the way that you will be looking at it from a policing perspective.
Absolutely. So some of that guidance that came out right at the very outset of this health crisis, that guidance still stands. We've obviously had that additional information provided from criminal justice partners, and that is additional advice in terms of the criminal justice process. The guidance for policing and for the essential journeys stands exactly as it was at the start of this crisis, and for exactly the same reasons. Is trying to prevent the spread of the virus and keep members of the public safe and protect the NHS.
Okay, so the coast is closed, the parks are closed, the beauty spots are closed, it's all closed unless you live close by.
Absolutely. If that is your essential exercise and essential journey to take that exercise, absolutely. But we have found people travelling hundreds of miles across our county when that essential exercise could be taken in the same way, much closer to home. And we would absolutely urge people to continue to follow that guidance.
Okay, fantastic, great. The second question then is around PPE. You mentioned there that the police have got the PPE that they need. Is that the case then?
Absolutely, yes. And I know there were concerns at the start of the crisis, but since then there's been a national effort to coordinate the procurement of that correct standard PPE, and also logistically we've joined forces with other agencies so that the circulation and delivery of that kit and equipment is much more efficient and effective now. Here in North Yorkshire, we have sufficient PPE. All of our officers and staff are being provided with the guidance about what to wear and when to wear it. They are all out on patrol with the requisite kit and equipment with them, including masks and gloves and aprons and goggles, and the circumstances under which they should be provided, or those circumstances under which they should be used.
Fantastic, thank you. So I'm just going to turn then to some of the questions from the public. So very nice for the thanks that we've received as well. So those are appreciated. So Graham Shaw, Mr. Graham Shaw has asked whether what's the difference between going out on a push bike for a ride and the difference between that and going out on a motorcycle.
Okay, so thanks for your question, Graham. As you know, cycle riding, as in push bike cycling, is deemed to be one of those forms of exercise. Obviously, the government want people to go out and take that essential exercise for their health and well-being and their mental well-being, whereas motorcycling is not deemed to be a form of exercise. You can, of course, use your motorcycle as a form of transport for your essential travel. So in the same way someone might have to get into a car to go and do their essential shopping, or for a medical appointment, or to get a short distance to your essential exercise, a motorcycle could be used as a form of transport. But going out on a bike for an unnecessary or non-essential journey for the sake of riding the motorcycle is not deemed to be an essential journey within the guidance that has been published. So that's why there's a difference between pedal cyclists and motorcyclists.
Okay, thank you, which takes us quite nicely onto the question from Clive Matthews, which is for me around cyclists and indeed other people taking exercise in communities that are not their own. So we have had quite a lot of communication from villages in particular with concerns around cyclists and some walkers feeling that they concerned that there are people coming into their communities that might be carrying the virus. We have asked people really to follow the guidelines, and that makes sure that exercise is local, and that applies to cyclists as much as it applies to pedestrians or anyone else. There are, interestingly, evidence from other countries, Belgium and the Netherlands, around the spread of the virus when people are exercising, which I think has caused some people to consider the way that they, the routes that they use, for example. So there are plenty of open roads at the moment, and I suppose from a practical point of view, it's trying to really appeal to people to stick to the roads and not to go through tiny little communities. I had one member of the public contact me saying that in this period of 2 hours she'd counted 43 different cyclists go past her house, and some of them had stopped off to have a bit of a picnic and had thrown litter and that sort of thing away. So the sort of energy drinks. So it's really a plea just to be aware that people are travelling through different people's communities, and just to be aware of the impact that might have, and to take measures that they can to minimise that. And of course, if any cyclists, get abuse or feel that that there's been an incident against them, then they must report that to the police as well, because that's not right either. So it works both ways. At least I don't know if you've got anything to add to that.
Just to echo some of the concerns from members of communities about the numbers of people travelling through their towns and villages and littering, etc. And this is just about, we absolutely want to prevent the spread of the virus, and the best way to do that is for people to follow the guidelines.
Yeah, exactly. Okay, super. So thank you. We've now had a message from a Dr. Richard Turner asking why people in towns and villages where there have been no cases of COVID-19, why they have to stay at home.
Okay, so thank you for that question. The government advice is really clear in terms of stay at home, protect the NHS, save lives, and it's in place for exactly the reason that you raise, Dr. Turner, in that preventing the spread of virus has been created by people not travelling into towns and villages away from their home addresses. So hopefully those restrictions have actually assisted your town or village in preventing the virus being brought to your village or spread around as a result of that restriction of movement of people travelling there who may have the infection. Of course, if certain towns and villages were allowed to move around, I think we might find that people will flock to those towns or villages where the restrictions don't apply, and that would be in direct contravention of what we're trying to achieve, of the health service trying to prevent the spread of that virus. So it's for exactly those reasons, to try and protect people's health and stop the virus being spread within those towns and villages.
Thank you. We've got a question here about why you, as Chief Constable, are making unnecessary journeys, including to Skipton, where I live. I don't live in Skipton, I live near Skipton, but Lisa, if you want to answer that one, please.
Yes, thank you for that question, Neil. And several other people have written into us asking exactly the same question over the past few weeks. I am still a warranted police officer, even though I am in a leadership position. And leadership of policing and as a police service, it is absolutely necessary for me to continue to provide a service to our communities. And part of my role is to show that leadership and be there and be out delivering a service to the communities, and that leadership position to the staff and officers who we are asking to turn up for work day in, day out, despite the risks to them and their families of delivering that service. And I am part of that organisation as a warranted police officer. So just to reassure you, it may be just as a result of the social media, I have been out across the county to Whitby, York, Harrogate. I'm due to go to Selby later this week. And it isn't just a visit. I've physically been out on patrol delivering a service to the communities, and also ensuring that our staff and officers have the kit and equipment that they need, that their well-being is looked after, that we are delivering a consistent service to members of our community. Because of course it's my job to check that those things are in place and that our officers and staff are delivering a consistent service and have the things that they need. So hopefully that answers your question.
Thank you. We've, I think, dealt with the question around allotments from Mr. Chancellor Chadwick. Challenor Chadwick. So I think that's fine. There is guidance on the Allotment Association's website. There's a question here about table tennis and croquet, and whether or not those sports are possible.
Okay, so I would take you back to the guidance about what is your form of essential exercise that you would normally take. Is it socially distanced? Is it preventing the spread of the virus? Is it achieving all the things we want to achieve? So if your usual daily exercise is to play table tennis and to undertake croquet, they're the exercises that you would normally undertake, and you're not driving hundreds of miles to undertake them, because that's where you would usually go, and it's safe to do so, and you're not in large groups of people, and you're abiding by the guidance, then it would fall under exactly the same criteria that we've discussed, that you're making an essential exercise journey in order to look after your health and well-being, as long as you can socially distance and prevent harm coming to yourself from a spread of the virus.
And there's an issue here from Mr. Freeman about being offered a alternative accommodation in East Devon, and whether or not that is appropriate.
Okay, so as you'll have seen from some of the other guidance, there's been a lot of publicity about people travelling to holiday homes or second homes or those sorts of premises. I don't know what sort of premises this is, even though it says it's rent-free, so it might belong to a friend, etc. Essential journeys can only be made for essential reasons. So if you are at a home address now, self-isolating, then travelling to another location such as this wouldn't be deemed to be an essential journey as per the guidelines or the legislation.
Okay, thank you. So that's a no, perhaps, unless you've been made homeless or something like that, when it might be more essential. Okay, and now this is a common question about people being concerned around the behaviour of neighbours and other people in their community, thinking that the rules don't apply to them, and people feeling conflicted because they don't want to dob in their neighbours, but actually they are concerned. What advice have you got for that, Lisa?
Okay, so Edward, I do empathise with you, and this is absolutely a common issue that is raised with our officers and staff and calls into our control room. And it's fully understandable that people are concerned about these things. So if we go back to the whole purpose of our partnership activities around this crisis is to prevent the spread of the virus. And absolutely, it's concerning that people are visiting other people at home addresses and potentially taking that virus into that address, and then it being spread on and put other people's lives at risk. The legislation and the guidance are such that being in a private place is not covered by the legislation. So the police cannot go into that home address and deal with any sort of legislative response to that private activity taking place. However, how those individuals got to that address and whether they were making a non-essential journey could be assessed. So they may be visiting a vulnerable person or dropping off urgent supplies, or we would have to take each case on its merit about the reason why that person was making that journey to that house. But it's not illegal for them to be at somebody else's home address. It depends on the reason they're there and the reason they've made that journey. You also mentioned, Edward, about people going out in their car for a day out. Obviously, we are stopping and engaging with motorists about what journeys they're taking, where are they going. So the likelihood is if they're travelling to somewhere for a whole day out, somewhere to a beauty spot, as we've discussed, that they'll be stopped and spoken to and advised and encouraged to go home. And if they don't abide by that advice, then we would take enforcement action where it's an absolute last resort. And so going out on those journeys, they can only make essential journeys, and we would seek to encourage those people not to make those journeys that are not essential. But again, case by case basis, it depends on why your neighbours are going out, where they're going, are they going to an essential place to get their shopping, etc. And we wouldn't know that without actually engaging or speaking to those particular individuals.
I have to say, I mean, one of the things that I've noticed is a sort of family trip out to the supermarket. And I have to say, I mean, okay, if you're a single parent and you've got no childcare, then you obviously need to take your children with you. But I have seen whole sort of families going to the supermarket, and as an individual, that's quite tricky when you're navigating the aisles, I have to say.
Absolutely, and I think this is where we go back to this is a health partnership approach to trying to prevent people getting this horrible disease. And that's the advice, really, that you protect yourself by staying at home and not mixing with those people. So the least contact you can possibly have with other people, you're safer leaving your family at home. So if the advice would be the love and care for your family, the best advice is leave them at home so that they're not at risk of catching the virus.
Okay, so very quickly, I'm conscious of time. So we've got a question here around pets and whether you're allowed to go and pick up pets and puppies, and what is animal welfare and what isn't.
Yes, a difficult one without the very specific circumstances. If you've ordered a puppy that you've purchased and it's perfectly safe and well staying where it currently is, I would imagine somebody stopping you to make that journey would deem that wasn't an essential journey for either your health and well-being or shopping or exercise, etc. So it would depend on the individual circumstances. But of course, we do have to look after animal welfare. And if you're talking about, for example, where there's a risk situation, and I know that we're still working closely with the RSPCA on any sort of animal welfare issues, this really is a case-by-case basis of the reason that you're making that journey, and is it absolutely essential when you look at the guidelines and the reason why we're trying to stop people moving around and prevent the spread of the virus.
Okay, thank you. So I'm going to move on to Mike now. If there's any questions that haven't been answered, we'll endeavour to answer them. So thank you for that, Lisa. Mike, can I ask you to come in about the criminal justice stuff in the first instance, and then just perhaps just give a little bit of insight into what is going on more broadly within the sort of council and NHS, because I know you're involved in that. Thank you.
Of course, yeah, and just conscious of time, I'll give just a run through of the impacts on the criminal justice system and focus on 5 particular points, talking about the impact on the courts, witness care impacts within our custody suites, and then the release of prisoners scheme, which is currently ongoing. The key message I do want to put across, though, really is that the criminal justice cogs are still turning and those processes are still going ahead, and also victim care procedures are still going ahead. It's normal business. So anybody concerned that although the criminal justice system is not working in the normal, because we're in a new norm, people are still presenting at court, and the procedures are still continuing. Just in terms of the governance around criminal justice, then clearly it's a national issue as the response to COVID. So there are national boards which are focusing on criminal justice and custody, those 2 separate areas. And our head of criminal justice it gets daily and continual updates on the national picture so that we can administer any changes or log any risks at a local and regional level as well. From a regional point of view, there are daily criminal justice partnership conference calls, and what happens there is the CPS, courts, probation, and the Yorkshire and the Humber police ring into that so that we're sharing any particular issues that we have across the Yorkshire and Humber region. There's a joint risk register where the various different risks that COVID has brought to the criminal justice system are recognised and discussed. There's also a local criminal justice partnership, which Commissioner you chair, which picks up some of the local issues with all the partners around the table as well. And then the overarching from a COVID point of view is we have a gold, silver and bronze command structure in place. And I, as the police goal, to take weekly updates from our head of criminal justice to ensure that all the risks, particularly for North Yorkshire in relation to criminal justice and victim and witness care, are picked up and we deal with issues as they arise. So impacts on the courts. You will have probably seen from the public's point of view some press interest just in terms of the reduced operations within courts within North Yorkshire, and they have ceased operating. And now our cases that do need to go to court will go to Leeds at present time. So there is no physical court appearance at the moment and attendance, as you would expect, because of social distancing. What we have done from tomorrow within North Yorkshire, our virtual court system for remand prisoners will be set up. So essentially what that's like is very much like we're doing now, a video conference, so that prisoners who are still in police stations can have that initial appearance at court without physically going. That's a really good piece of work that North Yorkshire Police, along with our information and technology colleagues, very quickly set up in a short space of time within the 3 custody suites at Scarborough, York and Harrogate. Trials obviously have been halted. That is continually reviewed because the court system are very, very keen to get trials back up and running, for obvious reasons, to ensure that people get the fair trial, to ensure that those victims get the outcome that they're looking for, to ensure that the witnesses are looked after as well. So those are continually reviewed, and we hope nationally to try and get trials going as quickly as possible. But again, that's a national steer in terms of when the lockdown restrictions will be reduced and how the courts will be affected from that. There's also a lot of work ongoing around out of court disposals, so trying to reduce the impacts on the court by appropriately doing disposals with those convicted outside of that court system as well. So lots of things to try and reduce the impact on the court. In terms of witness care impacts, just to reassure those out there who potentially are waiting for court dates to go as a victim or a witness, that contact is continually ongoing. Clearly not face-to-face now, so a lot of contact over the phone, a lot of reassurance still with those victims and witnesses who were already anxious around attending court and now have to deal with the anxiety of obviously a COVID lockdown. So just to reassure, continual contact through our victim care teams, What we do need to do, though, is have plans in place for when the courts recommence in full capacity and have a recovery plan to ensure that we can have enough victim care, witness care officers to be able to deal with the potential influx in court cases, because there will be an inevitable backlog. So we're looking into the future around the recovery plan, especially focused around victim and witness care as well. And just internally within our custody suites, clearly a custody environment is with interview rooms and cells, as you may imagine. We've had to put lots of control measures in place to ensure that anybody attending custody, whether it's a suspect, police officer, defence lawyer, solicitor, can be safe in relation to offering PPE, making sure that we change the environment of custody, try and move some of the furniture around, put screens up to ensure that we reduce the risk of physical contact and reduce the risk of the spread in there as well. And we're also utilising technology again, so that face-to-face contact between defence solicitors and suspects doesn't have to be done face-to-face. It can be done at either end of a laptop as well. So a lot of work that's been ongoing over the last few weeks. But just to reiterate, custody suites still normal business from the policing point of view. They are still open 24/7. Every day of the year, and they will continue as such with the measures that we've put in place. And finally, just around the release of prisoners, again, clearly there's a national state to ensure that the spread of the virus does not obtusely affect prisons within the prison population or the staff working in prisons. So there is a process that we have seen in the press in relation to releasing prisoners back out into the community. That's a very robust risk assessed process to ensure that the right people who are near to release, who haven't committed a particular serious offence, can be released back into communities. We have a robust process in place from a criminal justice point of view when suggestions of people being released into North Yorkshire come across the desk at North Yorkshire. We review those and we're able to appeal them if we disagree with the decision based on risk that they should not be released into our communities. And that's looked at daily on a continual basis, and everything has to be obviously officially signed off at the right level before someone is released. But what I can say from a North Yorkshire point of view, it's been minimal impact in relation to the release of prisoners within our communities. So that's it really from a quick whistle-stop tour of criminal justice.
Thanks. So, Mike, I'll come on to, Will's got a question about testing, but we'll come on to that when you do the LRF bit, because there's testing involved in that too as well. So just in terms of supporting victims, I'll probably, Will, do you want to ask you a question?
Yeah, it was covered up a little bit by Mike on his victims and witnesses section. It's just how are we better supporting victims in that and witnesses through the sort of delays, and then in potentially the stress of having not dealt with this thing for a year and it all coming back then to court, as you say, when courts recommence, who knows when.
Okay, so sorry, Mike, I'll just answer the bit about the now, because so we have a specialist team called Supporting Victims. They have seen numbers of because crime is going down, the numbers of calls going into supporting victims is going down. So there is plenty of capacity in supporting victims to support victims in particular at this moment in time. So there, those victim services that we have in place in North Yorkshire are open and are providing support, and we would encourage victims to come forward, particularly people who might be in domestic abuse situations, for example. Those services are open, as is policing.
And I would just reiterate that, Will, just in terms of we have a very strong victim witness care team who initially were impacted in terms of having to self-isolate and not be at work, but we're back to our full capacity, and we are there to help victims who are currently going through that process. But let's not forget also those victims who have not yet reported certain crimes, and that may be domestic abuse related, and we encourage anybody in that situation. We are still here. Please contact us. You can either ring the police direct or you can ring victim care services, but ring 101 from the police if you need to report anything that you haven't yet reported, because we do have the relevant teams who will look after you. The policing has not stopped in any form, and we have extra capacity in certain areas, and certainly from a victim care point of view, we will do what we can to support current and the future victims as well.
Thank you.
Thanks, Mike. Okay, so do you want to just touch on the LRF work that you're doing, and also just might be worthwhile just explaining what your role is in that as well, because it's sort of different to your policing role.
Not a problem. Yes. Well, my policing role is bless you. My policing role is as force gold for the COVID-19 response, but also feeding into the local resilience forum. I'm also the chair of the strategic coordination group. So in any response to a major and critical incident, we have under the Civil Contingency Act, we have to co-locate, we have to communicate together, we have to coordinate, and we have to have a real joint understanding of risk. So very quickly, at the very start of March, our local resilience forum stood up a strategic coordination group and a tactical coordination group. So basically what I'm talking about there is the strategic is your gold level individuals from various different agencies, from the police, fire, Yorkshire Ambulance, local authorities, Environment Agency, Yorkshire Water, anybody who would normally be involved in a major incident. And we essentially have been meeting on a regular basis with the strategy of supporting the NHS as best we can through the COVID-19 response. What we currently have running is a multi-agency coordination centre which runs 7 days a week, and their focus is to deal with continual problem solving, again with the main strategy of supporting the NHS. So that may be, for example, PPE and getting PPE out to adult social care, assisting the NHS with them receiving the relevant elements of PPE, and on a daily basis those problems are looked at with a view to ensuring that we solve them and we solve them appropriately, and there's a joint understanding of risk on a daily basis, and we change accordingly dependent on what we're dealing with. But the main critical risks that local resilience forum's been running, and that I as the chair are focusing on, are critical care beds and capacity within the NHS, PPE, personal protective equipment across all agencies, the management of mortality in relation to excess deaths, which obviously we've seen nationally, and also very recently the testing facilities that we're going to have available across North Yorkshire. And our focus since the start of March is to really drill into each of those three initial key risks, 4 risks now, and ensure that every agency is playing their part to do their bit to support the NHS, and it has to be about joint coordination. So essentially that's what the Local Resilience Forum have been doing. We have today met, and certainly the work we've done so far seems to be having impacts in terms of the critical care bed capacity within North Yorkshire is at a really good level, and it's continued to come down. Our PPE in terms of what's been available across the Local Resilience Forum is in a good state, and we issue it out on a daily basis to various different agencies. We have a plan in relation to what we will do should we require extra capacity for excess deaths, and also we're just working up plans now around what we're going to do for testing across North Yorkshire.
So Mike, I'll use chair's prerogative a little bit here, but so there's obviously been a lot of concern in the media about care homes. So that's my first question. And then secondly, obviously, I think North Yorkshire's been, I think the vast majority of people have been doing what we've been told, and we're staying at home. And, is it working?
The first point on care homes, we have had infections break out within care homes across North Yorkshire and the City of York. It is something that the Multi-Agency Coordination Centre look at on a daily basis to get updates so we can react to any issues that we may have in a particular care home and support agencies, whether or not it's a private care home or one run by the local authority. There's going to be a lot of work over the next few days to focus upon the care homes to ensure that we do reduce the risk of the spread of the virus there and reduce the likelihood of death caused by a COVID outbreak. So it is one of the focuses. There is more work to do in terms of ensuring we've got the correct links in, that they have all the right PPE, that they're following the national guidance in terms of looking after the residents and the staff within the care home. So just to reassure you, it is part of the LRF's work to make sure we reduce the risks to care homes as well. Laterally, and the last question, it is working. It is working. We within North Yorkshire, we're currently at 629 cases in North Yorkshire and 183 cases, confirmed cases in the City of York. What I can say, having worked on this since the start of March, has been an incredible amount of work done with the pure aim of protecting the NHS, reducing the spread of the virus and reducing the number of deaths that we have in North Yorkshire. We are behind the curve in terms of the impact that it's had on our communities. We are in a plateau in terms of the number of cases that we are having. We have reduced the risk of us having a spike, which would have caused massive pressure within the NHS and inevitably caused excess deaths. So the work that we've done, but more importantly, the work that the public have done in North Yorkshire has meant that it's not going to impact us as significant as it may have done. However, we are not out of the woods. We still have got to do a lot of work. We cannot relax in terms of the social distancing that we're doing, in terms of the essential travel. People must still stay at home. These are only green shoots that we are honestly seeing now, but they're encouraging green shoots that we're clearly doing the right thing from a public point of view and from an LRF and organisations point of view. So we must keep working hard. People must stay at home. People must only travel for those essential reasons.
Thanks, Mark. I mean, earlier we were talking, you gave the example of somebody breaking down on the A64 and, you know, the AA comes out, and if there's a whole family in there and they've all got COVID, then they infect the AA man and then he goes on to infect somebody else. It's simple things like this that we might not think about that might actually really cause an issue, and we just need to stay at home.
So what I would say, this is incredibly hard. We've been at it weeks now. Everyone's affected by the restrictions that are in place, and we've got almost another 3 weeks until it's reviewed again. So I'm not saying it's easy. It's not easy. All I would say is, before you leave the house, as I do, before I leave the house, am I going out for an essential reason? Am I going to work? Am I going to get the shopping? Am I going to look after somebody who's vulnerable? If I aren't, or am I going out to do some exercise? If I aren't doing those things, or if I'm getting in my car to drive half an hour to go and exercise, would I normally do that? Probably not. Therefore, you need to be exercising at home or around your home address. And that's one of the issues that we've got, is that people now, especially over the last few days, we've seen a little bit of an issue where people are starting to travel away from home, and we are engaging those individuals and we are encouraging them to turn back around, and we are handing fixed penalty notices out to everybody because people understand, but we have to continually engage and continually explain, because when new potential guidance comes out, we have to understand that from the police's point of view, and we have to educate the public. So what I would say is, if people do think, well, actually, I think I'd like to go and exercise, I'd like to jump in the car and go 20 minutes. What if you break down, you're at the side of the road? What if you're in a road traffic collision? You need to stay at home. If we do this for the next few weeks, this is the tough time, then times will get easier later on and restrictions will get lifted. But they won't get lifted if people start breaching the restrictions now. So we really need to just stay at home. Even if you think, well, actually, I think that journey, I think I'll get away with it, I think it'll be all right, because it's a grey area. No, you'll be engaged with by ourselves, and we'll explain what that restrictions mean. But the easiest way is just stay at home.
Thanks. That is the key message. So, Will, your question on testing?
Yeah, so with a particular interest in policing, Commissioner, given your role on fire, but could you give us a little bit more about testing, Mike? Who's getting what? Are the facilities in place yet?
Well, obviously these national facilities, the NHS facilities in place that we've been using, certainly from a policing point of view, over in West Yorkshire, and we've had offer of some testing facilities up at IKEA up at Newcastle. Those testing facilities, week commencing the 27th, there'll be an NHS national testing facility in York, and also we're looking from a local resilience forum point of view to expand that testing out to the coast as well, and either to have a satellite site out there or to have something that's mobile that we can ensure that we get around our very large county. In terms of the policing and the fire side of things, we are at the moment drawing up a plan which is almost finished in terms of the police testing that's going out. Now we're still waiting some standing operating procedures before we can finalise that plan, but essentially those tests are certainly to reassure our police colleagues around it. Let's say they've attended an incident where there's a potential COVID risk, they've been coughed on or spat at, and they're in a key role, and that includes our fire colleagues as well, then there will be that ability to be tested to see whether or not those individuals have got COVID. That's one of our key priorities this week from a police and fire point of view. We are working jointly, but we're also working with regional policing colleagues to ensure that not every force is doing their own thing, because we can, due to the size of our county, at the bottom end, it's likely we might want to use West Yorkshire's facility, and the top end, we might want to work with Cleveland or Durham. So we're in the process of finalising that. We've had very low numbers go to those testing facilities at the moment, a very low take up, and that's testament to some of our very low sickness rates that we've maintained by keeping people working from home and keeping those tight restrictions in place within the workplaces as well. But once we're up and running, from a reassurance point of view, policing point of view, we'll be getting people tested when appropriate.
Okay, so is that fine, Will? Yep.
Yeah, thank you.
Good. Okay, so I think, does anybody else have any further questions for Mike? No, well, we're a little bit over, but Mike, I think you were worth the wait, so thank you very much.
Thank you.
And thank you very much, Lisa and John and everybody else. If there are any other questions that the public have, then they can contact us in the usual ways, into the office or on social media, and we will do our best to answer. So thank you very much, everyone.